Nightly News understands that some 200 persons are waiting to undergo some common types of orthopedic surgeries. The orthopedic unit has been making strides to reduce those numbers amid the challenges faced. Dr. Samru, head of the orthopedic unit, explained.
In terms of orthopedic surgery, they're somewhat the high end of surgery. So there's really a cost for these equipment and instrument for the surgery that is much more expensive than doing the trauma surgeries. But we do have the instruments for the surgeries. What is keeping us back to some extent is implants and to get new instrumentation, to update our instrumentation.
Dr. Samru revealed that the unit is unable to conduct as many surgeries as is necessary as a result of the limited instruments.
The cost of implants is somewhat a bit expensive, and because of that we are unable to do the amount of joint surgeries that we would like to do. We would have done joint surgeries, but in my opinion they're not sufficient in terms of the amount of patients that are coming to us. If you compare the amount of patients that require the surgery and the rate at which we're getting the surgery, there's a great disparity there.
He added that a number of companies have signaled interest in assisting the hospital in acquiring the critical pieces of equipment needed for the surgeries.
We did have a number of local companies as well as overseas companies that came in, and they have actually bid to facilitate us with the instruments as well as the implants for the surgery. And we have all gone through the bids that were presented in terms of looking at which is more feasible and which is technically of the correct quality to do the surgery. So that process has been for some time under review before it has been approved by Cabinet for us to select which company to take these instruments from.
Just last week, a group of surgeons from Maryland visited Guyana for the second consecutive year and successfully completed some 50 joint replacement surgeries. Nightly News was reliably informed that the team imported their own equipment in this instance. Nonetheless, Dr. Samru maintained that the local team of surgeons are able to facilitate a number of trauma and orthopedic deformity surgeries. Tamika Rodney reporting for HGP Nightly News.